Some patients have cyanosis with murmurs heard in the chest, and the cause is pulmonary arteriovenous fistula. There can be macro and micro pulmonary arteriovenous fistula. In the macro arteriovenous fistula, we usually see dilated feeding arteries and dilated draining veins, as noted in the frontal and lateral views of the chest of this patient. The radiographic findings are pathognomonic of macro AV fistula. This is a patient with a nodule in the left base. There was a large feeding artery and a large draining vein. And on an angiographic examination seen to your right, you can see a filling of the feeding artery, of the aneurysm, and of the draining vein. This patient had bilateral pulmonary nodular densities. Both were related to macroarteriovenous fistula that are well delineated in this pulmonary angiographic examination. This CT image shows a peripheral pulmonary nodule connected to a tortuous large vessel. Note that on multiple image projection, we can see the feeding artery and the draining vein, pathognomonic signs of a pulmonary arteriovenous fistula. In this three-dimensional reconstruction of multiple image projection, note a pulmonary arteriovenous fistula with the feeding artery and the draining vein. Another three-dimensional reconstruction in the sagittal plane of a pulmonary arteriovenous fistula, revealing the nodule, the supplying artery, and the draining vein. This is a typical large left arteriovenous malformation. Note that there is a large supplying artery as well as a large draining vein, and that the mass is noted next to the left hilus. The connection of the mass to the pulmonary vasculature is pathognomonic for a pulmonary arteriovenous malformation. Another case with pulmonary AV fistulas in the right lung. They can be embolized successfully, and in this way surgery may be unnecessary. In this patient, we see a large AV fistula in the left base. Note the markedly enlarged supplying artery and the large draining vein. This is a lateral angiogram of the same patient showing the location of the AV fistula in the left